The organization or the agency as it existed was not a full-fledged agency in the sense that it didn't have a statutory backing. And that was the whole essence of having the NCDC Act of 2018. What it does now is that the agency can be properly funded by the government of Nigeria. Most of the initial funding for the agency, it went through a lot of transitions, like a department, and then, it went through those processes before becoming an agency. And most of the money that had come for it mostly were, of course, through donor gateway, because also the donors were particularly concerned, especially post the West African Ebola outbreak. It was very important to make sure that Nigeria, based on population indices too, should have a standing National Institute of Health of sorts, which is NCDC. And it should be able to do research, surveillance, and the gamut of other activities that can help us be able to rein in an outbreak of that nature, especially from our own country level. Working with other partners, transnational collaborations and all that. So it has survived, and it has over time been able to assert itself, and it has a CEO, but just that one item was missing. How will it be able to appropriate funding domestically for its functions? And that signing of the NCDC Act in 2018 into law, which just happened recently, thanks to Mr. President, has shown some political will to be able to set in structures.
And that, I think, is one of the most significant items that was missing for the NCDC. Now, it's been able to scale the paperwork. It's gotten the appropriate legislative backing from the presidency. What do you think will change for the organization going forward?
Going forward, the organization has gone through the process of even developing a national action plan for health security, which will be launched in December. It's going to be a watershed, especially for even West African region, because it's of interest to everybody. And that action plan enables it to look at all aspects of its work, to be able to work with stakeholders, with communities, and particularly I want to mention it here that it's not just NCDC alone. There are other players, whether Ministry of Environment, Ministry of Water Resources, that play in that space of health security. And it's very important that state governments and local governments are part of this playing field, because it's very important, because just at the national level alone, NCDC can only do so much and show so much leadership. But if downstream, ground zero of where disease epidemics can actually wreak havoc are not handled properly, then we will still be in the same problem we are. But what has happened is that with this new opportunity for Nigeria, we can be able to look towards reining an epidemic faster, because we should be able to have some funding for NCDC moving forward. We should be able to have a national action plan that works for us, bringing in all the major stakeholders in place to be able to be part of that agenda for epidemic prevention and response in Nigeria.
Now, Francis, between its establishment in 2011 and now, the Nigeria Center for Disease Control has had to wait for 4 years to get legislative backing. Now, one of the chief mandates of the organization is to protect the health of Nigerians by watching out and curtailing the spread of possible epidemic across the country. Now, let's look at the spread of the Ebola, which in eastern Congo specifically, which the WHO has now said is the second largest as far as that disease is concerned. To what extent would you say that the Disease Control Center in Nigeria is prepared in the event of a spread?
I think that question will better be answered by the CEO of NCDC, but I can assure you that from the little information I have currently, the emergency operating centers across the country have been activated to a level where the surveillance mechanisms have been put in place in a lot of states in Nigeria, especially states, not just only because of Ebola. We are going into the dry season, the Harmattan period with Lassa fever and all whatnot, and we are also having other forms of epidemics like the yellow fever epidemic and all that. So it is not just only about Ebola, it's about a gamut of things. And I also mentioned that Nigeria is beginning to have serious issues around antimicrobial resistance. This is also one of the things that the National Action Plan for Health Security looks at. So, but this is a conversation for another day. But what it means is that they are working towards that. They're making sure the right instruments are there, the right people are being trained, the capacity is being built across the country to be able to make sure that surveillance primarily is good and information exchange is is as quick as possible, because with ICT gateway and everything these days, you can get information at the tip of your hand. So where there's any place where there's an identified or suspected case, they can be able to respond as quickly as possible in identifying what the culprit is and be able to respond accordingly in terms of timelines. But I think basically moving forward, they have actually been doing a lot of work, because I've been part of a coordination meeting that has been put in place recently with NCDC and all that.
I was going to ask you to explain to me the nature of the relationship among your organization, the NCDC, and the government as far as collaborative efforts to curb the spread of HIV virus is concerned.
Yes, I think it's something that is young, is growing. Like you mentioned, NCDC is relatively young, and it's a new entity that is into the health space in Nigeria, the public health space particularly. And of course, it has to grow its wing and be able to fly the way it should. And this involves being able to engage other stakeholders, including government agencies at all levels of the tiers of government, and be able to work with them to be able to do better things. And it hasn't been challenged currently by a massive epidemic, but I think the level they've gone so far is that they have been able to begin to put in place the right mechanism for response, bringing in all stakeholders to the table and be able to know that they have a role to play in response for epidemics.